I was younger, when I was at school, I didn't know that being an osteopath was something you could do. So I had a place at university to do neurobiology, but I wasn't sure what I was going to do with that. So I decided to defer my place and to decide later what I was going to do. And when I deferred the place, I went and worked for a little while, and I started doing a bit of yoga. I learned a little bit of about alternative medicine and decided that I wanted to learn about alternative medicine. I don't like needles, so I was never going to be an acupuncturist. And somebody said to me, well, what about being an osteopath, which I had never thought of. So I went to an osteopath to have a bit of treatment, and I thought, yeah, I could do that. So that's how I trained.
Okay. Can you tell us about what school and teachers had big influence on you?
So I started my training in 1985. I did 3 years of my training at the British College of Naturopathy and Osteopathy. I then had my son. I had 3 years out, and then I did another 2 years. So I repeated my third year and I finished my course. So it took me 8 years to do a 4-year course. So in that time, you change, and also your perception of your teachers change. But I think the people that most inspired me were the old osteopaths like Dennis Kiley, who was an osteopath and a naturopath, the professors that I had in naturopathy like Jonathan Shaw, and then my teachers later when I've been doing my cranial courses and my biodynamics courses like Christian Sullivan and Sue Turner, and also my dear colleague Gabby Colangelo, who was with me at the Osteopathic Centre for Children, and Stuart Korth, who was also a mentor.
So now, correct me if I'm wrong, you follow more the Sutherland line?
No, I'm an osteopath. So I take everything that I learn, and I have done all of the Sutherland pathway, I've done the biodynamics pathway, I've done the Osteopathic Centre for Children diploma, I've done a few craniosacral courses. You learn from everything.
And since when you have this passion for treating a child?
I didn't ever mean to treat children. When I was a new graduate, a patient had heard I did a cranial course, and she brought in her baby with colic and said, well, osteopaths can treat colic, you fix my baby. So I tried to do something. I didn't know what I was doing, and to my surprise, it worked. Baby got better, so then I thought, maybe I should learn. And my friend Gabby, who I trained with, was at the OCC, the Osteopathic Centre for Children. She said, Karen, come to the OCC. And that was how I got involved in treating children.
How do you see our profession nowadays?
That's a big question.
Yeah. But we can divide it in the teaching, the practice, the science, how do the osteopaths approach science, and how do the doctors, the conventional medicine, see our profession?
So, in terms of how do I see our profession, it's difficult, I think, because we have this kind of, we straddle a boundary between the medical profession and being more working with what we see, what we feel with the natural world and what our patients tell us. And that's a very difficult line to try to follow. So when I see some of the newer graduates, a lot of them prefer to have like a little recipe book, and they want to know how to treat something, to fix something. Whereas I think when I was learning, we were taught principles and to apply the principles of osteopathy. And I think that has changed.
So do you think that the medicine, conventional medicine, is seen as more like science or more like esoteric?
This is us. I think it depends on who the medical profession come into contact with. There are osteopaths who work very structurally and much more with attention to evidence-based medicine at one end of our spectrum, and then there are osteopaths who work very much outside of the conventional kind of current models. And so I think it depends whether or not you as a practitioner and how you interact with your own local medical community, how you're seen and how they believe you work.
If you were like a new student starting first year, what kind of school and what kind of place will be your choice for entering the profession now?
Well, in the UK, I don't get so much contact with the undergraduate schools, but I think my advice to anyone is to find a school that you feel at home, and to find a way how the school teaches and the kind of people that the school has. You need to find something that fits with you and with your own sense of what you want to do. So some osteopaths will go to a school because it's quite a bit more medical and a bit more structural and a bit more evidence-based, and then other people will go to a school because they just want to treat children and they want to do more of the cranial approach, and so they will choose a school that has more of those teachings.
Okay.